being that it's Monday and we're still in the middle of a pandemic and because something popped up over the weekend that I didn't notice.
So we're still in it.
We're still in it? Okay, good. Ben, we're going to spend some more time with our good friend, Dr. Dennis Norem from Mercy Health as we continue the COVID conversation. Dr. Norem, good morning.
Good morning to you guys.
How's everything with you this morning?
Well, everything's going well, but I'm disappointed, Riley. I really do like that song from Jerry and the Pacemakers, Ferry Across the Mercy.
Do you really? Yeah, I expressed my distaste for it the other morning. I knew there would be blowback, but I didn't expect it coming from you, I guess.
I didn't know you were in the 5 o'clock listener club, Dr. Norem. Congratulations.
Well, occasionally I am. I do rounds very early on Wednesday mornings, so I always enjoy listening to you guys.
Oh, thank you.
Yeah, and you had a song stuck in your head throughout most of those morning rounds, too, I'm sure.
I'm sure, trying to get myself awakened enough to do some good.
Well, it works out fine. You're with Mercy Health. It's Ferry Across the Mercy. It seems to all work together just fine. Hey, some good news potentially coming out saying that nursing home residents, long-term care facility patients might be looking at some of the vaccines by Friday, assuming we get an approval on Pfizer's new vaccine.
Yes, it looks pretty certain that Thursday we'll probably get approval from the FDA. And as your news report said, there's already, I think, 5,000 doses have been shipped here to Mercy here in town. We've received actually an email communication of docs to take a little survey about whether we would take the vaccine and how many of us would. But I have no idea about who actually gets it first. My assumption is that it would be the frontline workers, obviously, who are exposed to COVID day in and day out. And then how much of that will go to the frontline workers, how much will go to the nursing homes, I think that's yet to be determined.
You think frontline workers will be vaccinated before nursing homes?
You know, I don't know. Some of those decisions are being made locally, and I just don't have any information yet about that.
Based upon the news conference last week by Dr. Sandra Martell, I believe she had put it out first that frontline healthcare workers would be looking at it first, long-term care facility patients would be looking at it next, and then we'd kind of deal with a slower rollout as it goes to where working its way down through the population by late spring. I think was the goal.
Yes, excuse me. I think that's what I've heard locally and sort of nationally. If you look at the national information, we would assume that we'll get approval of Pfizer this week, Moderna next week, and then the AstraZeneca product probably fairly soon also. But in order to make those kinds of numbers to be able to vaccinate the population, we're probably looking into mid to late spring to really get it out to the general population.
Looking at some of those numbers, there was a poll taken. Who took this one? I'm not sure. Some news organization between November 20th and December 2nd. 78% of people are concerned about the vaccine. 63% of them say they're worried about potential side effects. 43% don't believe it will prevent them from getting COVID. 19% just don't like to be vaccinated, which I thought was odd. But 40% say they would be more likely to get the COVID vaccine if they saw Dr. Anthony Fauci get inoculated first.
I think that's an interesting and actually a very good example of what we can all do. I think we need to all publicize getting vaccines, and hopefully that would include, the 3 previous presidents who volunteered to show that they would get the vaccine on live TV. So I'm hoping that happens, along with a lot of our officials, obviously FDA officials, and I think Fauci, probably will go ahead and do that. He's made mention when it's approved, he's going to get it. So hopefully he'll do that publicly.
I don't want to put the cart before the horse, but that's exactly what we're going to do right here. The vaccines start going out, and it starts to become part of what people are doing. Will our social distancing efforts and masking, how long after it starts being developed or distributed do we have to still hold on to these mandates?
Probably for quite some time, because as you may remember, the vaccine's been proven to reduce the severity and the symptoms of the disease for the individual. Nobody knows yet whether it will reduce the spread, which is an interesting, you assume that those two things go together.
Right.
If you can stop an individual from getting it, it should stop the spread of the virus. But there's some concern that, and we've seen this with previous vaccines, like the flu vaccine, where yes, it reduces the severity of the illness for the individual, but the individual is still infective, to other people. So we assume it's going to reduce the spread, but we just don't know how much.
And how long? And about how long after the vaccine gets rolled out will we have good concrete numbers on spread numbers?
I think it's going to take weeks to months because we're rolling it out in a very limited fashion, and we're going to need to see lots of numbers to be able to come up with some kind of idea of how effective it reduces the spread. In other words, we've studied it in studies of, 30, 40,000, 50, up to 60,000 patients. But I think you're going to need to see more like hundreds of thousands of patients before you can tell, okay, here's how effective it is in reducing the spread. So in the meantime, we can't let down our guard. People are going to have to continue to mask, social distance, and be careful.
Now, what is, now obviously, ultimate best case scenario would be the vaccine rolls out, everybody gets it, and coronavirus disappears, nobody's spreading it to anybody, numbers drop precipitously down to, plus or minus the whatever the margin of error is. I suppose that would be best case scenario. What's realistic best case scenario on the vaccine rollout?
Well, I think a realistic scenario is it's been shown to be 95% effective. That's in controlled studies, probably in the general population, given some of the issues of effectiveness and storing the vaccine and making sure it's given properly. Hopefully it'll continue to be 70, 80% effective. Then we have to pass the next hurdle is what percent of the population is going to agree to get it? If half the people refuse to get it, it's going to make it very difficult for us to reduce the spread of coronavirus. Even under the best case scenario, I think there's a concern that it's not going to go away, that we're going to deal with this down the road with little outbreaks here and there. So I think that we still are left with this whole conundrum of we just don't know a lot of the answers to these questions until we actually see what happens in the real world.
It seems like we can't talk about this without talking about the flu at the same time. We've been working on the flu vaccine now for a couple decades. That comes out to 50% effective on average. It seems like. Why should we believe that this is this new vaccine we've only been working on for a year is up to 95%? What's how do we deal with that kind of inconsistency?
Well, I think one way we deal with it is the totally new vaccine. These two, Moderna and the Pfizer vaccines, are this messenger RNA, totally new type of vaccine. So I don't know that we can make a comparison to the flu vaccine in that sense. I think if you look at the AstraZeneca vaccine, that's more like the flu vaccine. If you remember, their overall effective rate was 70%, and when they took out that subgroup that received half a dose at the beginning, it was only about 60%, which is consistent with what we've seen with flu vaccines in the past. So I'm hopeful that holds up. We just don't know. But again, it's a totally new type of vaccine.
Could what we learn through developing a vaccine for COVID help our flu vaccine down in future seasons?
Oh, absolutely. There is work, I think, on the same type of vaccine for flu, with the idea that with a different type of vaccine, there's thoughts that down the road we'll be able to get a flu shot possibly every 3 or 4 years instead of every year.
Oh. Yeah, well, that would be interesting. Mm-hmm. That would be, because a lot of people, put it on the calendar or go, okay, yeah, this is the month that I definitely have to go every year. Knowing you'd put that back to 2 and 3 and pretend 4 years wouldn't be such a bad deal at all.
No, and it would make compliance, much, much better because every year you'd catch the person that hadn't had it maybe last year. Okay, fine, you missed a year, you missed a couple years, not a big deal. But that remains to be seen. But I'm sure these companies that are doing vaccines are going to work on this type of vaccine for not only flu, but probably for other diseases also.
Is it safe to assume that all eyes are going to be on the UK this week? Because tomorrow there is the beginning of their immunization program. They've got about 800,000 doses of the vaccine expected to be in place for this starting on Tuesday. You also have the Russians. I noticed this on Saturday began vaccinating thousands of doctors, teachers, and others at dozens of centers in Moscow with their own vaccine, Russian-made Sputnik 5 vaccine, which was approved over the summer, but they only tested it on a few dozen people.
Yes, I think all eyes are going to be on both. Obviously, the UK is just a week or so ahead of us, so I'm sure there's going to be some lessons we can learn from them. And I don't know what to make of the Sputnik 5 vaccine in the sense that very little testing. I believe it's an older type of vaccine. It's not the messenger RNA vaccine. So it's really questionable how effective it's going to be. And, of course, the third problem is, are you going to get any kind of a straight or honest answer out of what's going on over there?
Yeah, that's the other problem. Over in the UK, they say patients aged 80 and above who are already attending hospitals as outpatients and those being discharged after a stay will be among the first to get the shot. Hospitals will start inviting over 80s in for a vaccine shot and will work with nursing homes to book staff into vaccination clinics. Any appointments not taken up will be offered to healthcare workers deemed to be at the highest risk. Everybody else who is everybody's vaccinated is going to need a booster about 21 days later.
Right, it's the two-dose vaccine, so we have to make sure that people get the second dose and that we have the doses to give them the second dose. But again, I think we're going to watch what happens in the UK very closely. Clearly, the big issue is, are we going to see some kind of side effect that we're not or haven't seen so far? And that's going to be a key to, I think, people wanting to get the vaccine. Unfortunately, with the social network we have in this day and age, if there's some major complication or side effect in patients, that's going to be all over the internet in 5 minutes.
Yeah, that's going to be a huge concern if something comes down that after that first stage, something happens to somebody that they won't get that second stage. Is the vaccine completely useless if you don't get the second stage?
No, I believe it is not. I believe, and I haven't seen a number on this, but I believe you get a pretty good response with the initial vaccine. But in order to get that 95% response, you need the second shot.
You had said earlier here, and it mirrors something that I'm looking at here, not to let your guard down. Headline in the Associated Press this morning, health officials warn Americans not to let their guard down. On what overall?
Well, I think on this whole thing with the COVID fatigue, we're all suffering, and now we're seeing tightening of restrictions again. And you know, the natural tendency is to say, "Oh crap, I just can't take this anymore. I'm not going to be as vigilant and as careful as I was several months ago or last month. I'm tired of this." You know, and this is the peak here. Hopefully this is the peak, but we're going through this holiday season. We just had Thanksgiving. We're going into Christmas. Obviously, people are going to be getting together to some extent, and we're very concerned. Our death rate, but over the weekend, hit almost 3,000 cases, well above any of our past experience. So things are not going in the right direction, so people need to continue to be vigilant and be careful and do what they need to do. Mask and distance.
Speaking of death rates, a lot of buzzing online about what happened to our flu deaths. The flu death numbers are down. Are they down, or we're just not in the season yet where flu is at its most dangerous?
I think both. The flu season, this is usually the beginning of the flu season, but over the years, typically the bad time of the flu was probably right after the first of the year. Kind of, again, people got together for the holidays, they traveled, they had lots of exposure. So right after the first of the year kind of would be the peak, although we've had different years do different things. I suspect our flu rate's going to be down. all this social distancing, masking, and sanitizing should make a big dent in our flu this year, but that remains to be seen.
Yeah, I was thinking about that the other day. If we continue on with the protocols that we've been advised to keep on with as far as coronavirus goes, that would have nothing, it would seem, but a net benefit for people trying to avoid getting the flu.
Absolutely. Those are the kind of things that we've asked people to do during the flu season, which, cover your mouth, wash your hands, sanitize. If you're ill, if you think you're ill, don't go out and spread your illness to everybody else. So I would expect that the flu this year is going to be relatively minor in terms of numbers. The concern is we don't know what happens if people get both of those diseases together, and that could be a very bad combination.
And then one more thing about staying vigilant and masking up. And where are we at? 8 months now. We're still yelling about masks. I think there's been a shift of understanding of what the masks. They're not there to protect you per se, because we have seen the infection rates for people that do wear masks and don't wear masks are roughly the same. Is it still about protecting others if in case you're infected? Is so if we're tired of wearing masks and we're like, well, I'll roll the dice myself with it and and won't be as vigilant with my mask. It's not necessarily about you. It's about passing it on to other people. Is that still the messaging?
It's probably, I'd probably agree with that, because we talk about people that are kind of these super spreaders. Well, those are the unmasked people going around rooms and talking to people and things. And it really spreads it very quickly. If you are infected, you don't know it, and you're not being careful, you can spread it very quickly to a large number of people. And we've seen this with these outbreaks at parties and gatherings. So, please, people, keep wearing your mask and keep your distance.
And we'll keep our eye on what's going on in the UK, what's going on in Russia, and by the end of the week, we should see some of the results, or not results, but see some of the vaccines working their way out across this country as well, starting with healthcare workers and long-term care facility patients. Dr. Norem, as always, we appreciate the time, we appreciate the expertise, and unfortunately, we're in the middle of another wave of this stuff, so we're nowhere close to the end of it. We'll look forward to talking to you again next Monday if you'll be willing.
Absolutely, guys. I'll talk to you then.
We appreciate it. That's Dr. Dennis Norem from Mercy Health.